Hey, I love therapy, and in fact, I've been going to therapy since I was around 6 years old. Though I talk about therapy a lot and may interview some therapists on the show on occasion, nothing that is said in this podcast should be considered a replacement for therapy. If you are struggling, I urge you to please seek guidance from a therapist because you are absolutely worth it. Hello, everyone. You are listening to Wine, Dine, and 69, a podcast about dating, relationships, sex, and self-love. I am your host, Rachel Dalton. I hope that everybody's doing well. I myself am about 24 hours from opening my show, so that is exciting and terrifying at the same time. But you know what? I have a lot to get into, so we're just going to dive right in. The first thing that I wanted to talk about today does not have anything to do with the episode, and that is an article that I found that was published this past September called Normal Marital Hatred is Real. Here's what to do about it. And that's a pretty clickbaity title, but in the article they interview an author whose last name is Real. His name's Terrence Real, we'll say. And he's the author of a book called Us, Getting Past You and Me to Build a More Loving Relationship. This article talks about this idea that it is normal to go through phases of disruption in a relationship. They talk about here in the article that the relationship, any relationship, will go through these phases. And those phases include harmony and closeness, and then disruption, like I mentioned, and then a repair and a return to closeness. And, quote, this pattern can play out at the micro level 20 times in the course of one dinner conversation, or it can play out at the macro level over decades of marriage. And, you know, this kind of reminds me of something that I was considering a couple of years ago, which is the idea, is love a feeling or a choice? And I think it's funny because love, it should start as a feeling. You shouldn't just, pick somebody based on how they are on paper. So ultimately it should start as a feeling. But marriage, I think that marriage is a choice. And I think that to some extent, the love that comes with a long-term marriage is a choice. You're going to go through those patterns over and over and over again. Terrence Real, the author of the book that I mentioned before, that is discussed in this article, also says your relationship is your biosphere. You're not above it. You're in it. You breathe it. And I love that way of looking at a relationship as not just something that is happening to you between you and another person. It is an entity in and of itself completely. And you are a part of that. And just like it is our job to take care of Mother Earth, I'm really big about recycling. I don't know if that's come up on the podcast before, but my partner said that the 2 times that he's ever seen me get really, really angry is when I yelled at him over not recycling correctly and not taking care of the plants correctly. So that gives you a sense of that part of my personality. But taking this idea of a biosphere, the way that you are supposed to take care of Mother Earth, because she is our host. I love that idea of taking that and kind of putting it into the relationship lens. It also kind of reminds me of Landy Baton. He was interviewed in, I don't remember which, I'll link it in the episode notes. But the title of the article was another kind of clickbaity title called Why You Will Marry the Wrong Person. And it talks about finding a good enough relationship, not something that is, full of ups and downs and passion and depression, but something that is stable and good. Because good is better than perfect, as they say. So yeah, that was just an article that I found that I thought really tacked on to some of these ideas that I've been thinking about, the philosophy of relationships. And if you are into the study of that, I always recommend the Gottman Institute that was also mentioned in this article. always trying to find the secret to what makes a relationship long, successful, and happy. So let me know your thoughts on that. What's your relationship philosophy? Does that make sense to you? Do you have a different idea in which you think about a relationship? I'm curious, so let me know. The other things that I'm going to talk about today have a little bit more to do directly with the episode. Today, I interview the gynecologist, Shyama Mathews, who, oh my gosh, it's an incredible conversation. I wanted to start off 2024 with this episode because of just how dynamic this conversation was and how much I learned and how much I hope that you'll learn from it. So we go through a bunch of myths and FAQs regarding sex and the vagina and birth control and what we wish that penis owners knew about vagina owners, vulva owners, because they are two different things. I'm trying to teach myself that too. There's a difference between the vagina and the vulva. The vagina is bigger than the vulva. The vagina is the entire internal organism. It's important to know, make those distinctions. Okay, so one of the things that we talk about is male birth control. And, I'm going to link a article from 2016 in the episode notes from CNN Health, which is about when that birth control study was shut down because the men that were participating were having side effects that were very similar to what women experience when they are taking their birth control. But while I was trying to find that article, I came across something else, which is newer. I'm still a little late, but this is from May 2023. Oh, it was published 3 days after my birthday. So this is an article from actually not a site that I know anything about, but it's called Life Sciences Intelligence. Cool. And this is more about a gel. This is a male birth control gel that provides different options for men because, as we know, the onus for not getting pregnant is on the woman almost all the time. And so here, this is a gel that you put on. It's called NES-T gel. And it's a gel that you can put onto your shoulders. It's a mixture of hormones, which is what female birth control is also. And this article goes more into depth, but it uses different hormones than is typically used in the birth control used by vulva owners. So yes, this gel, as I said, is applied on a man's shoulder and upper arms, and it's absorbed through the skin. And it's gone through a 6-month trial, and it sounds like it's been relatively effective. It's needs to be used daily, and there are some rules. I think I read that you can't shower for, I think the number was 4 hours after applying it. But yes, it's a study that is still occurring. Results will be coming out more in depth hopefully sooner rather than later. I'm really excited about this. Now, my first thought though was, and you'll hear a story in this episode about one of my exes and his complete disregard for what I experienced using birth control, and he was just completely okay with the onus of the fertility issue being on me. And so one of my first thoughts when reading the study was, oh man, I would not trust most of my exes to use this product. I wouldn't trust them to remember. I wouldn't trust them not to shower. And I think that's something that a lot of vulva owners face is, okay, but I'm comfortable with it being on me. But then I thought about it and I was like, maybe that says more about me and how I'm choosing partners rather than men as a whole. Maybe I need to have more faith and the sample size of the men that I have dated. I just know how to pick them, apparently. In that I don't know how to pick them correctly at all. But I could think of one ex, and of course, my current partner would be they would absolutely be able to handle the rules that go along with making this male birth control effective. So, my first thought being, oh, I don't know that I would trust men as a general rule to stay on top of this, maybe says more about me and me being jaded than it does about men. So that's a me problem. And fellas, I have faith in you. Well, anyway, so I'm going to link all of that in the episode notes. So you're going to get all of it. But let's move on a little bit. So in my conversation with Dr. Shyama Mathews, we talk about a partnership that she has with Playground, which, holy shit, I mean, I just need to say, this is what I wish that Cosmo was. Instead of Cosmo being like 10 ways to blow your partner's mind, whatever, like all the stupid thing that is so much more focused on male pleasure. And Dr. Shyama said something amazing in this episode, which has really stuck with me since, which is, who is the vagina for? And I'm not even going to say anything more about that. I'm just going to let that linger there in the ether. But back to Playground. So this is exactly what I wish that I had had. Oh my gosh, there's articles about different types of lubrication, pregnancy and how that can affect your sex life. They partner with a bunch of different experts. They have a list of the podcasts that they've partnered with. They have a section called the School of Sexology, which has so many resources. I mean, there are areas where people can confess anonymously. There are articles about giving you advice about the vagina or about how to make sex less painful, because as we've said before, sex shouldn't be painful. And if it is, then there is something that you can do about it. You don't need to just endure that. But it's incredible. I mean, there are articles here. You can, Dr. Shyama does office hours with Playground, and there are podcasts. There's a community section. It's just such a cool resource, and absolutely what I wish that I had had, because the older I get, the more I realize that I really was conditioned, by society, like to do everything for the male gaze. And I'm trying to change that. I think that has been something that has come up a lot for me. And it's something that I've had to try to fight against a little bit. And just looking at what we're consuming and what I was consuming, you know, all these Cosmo articles and all these things that are focused more about how you can be hotter and better for a man. I think that even though I might have rolled my eyes at the time, I think that some part of my subconscious did take that in. I think a lot of people did. And I go back to that question, who is the vagina for? And I think that Playground is a great resource to really put the focus back on where it should be. So that's my little soapbox on that. I am going to cut to a quick commercial break as per usual. And then I know that you're going to love this episode. It just seems like the perfect thing to start the year with. Dr. Shyama is an incredible individual, and we had such a great conversation. And I can't wait for you to learn from her, and also, of course, follow her on all the socials so you can continue that learning. So, quick commercial, and then please enjoy my conversation with Dr. Shyama Mathews.
So, CBD is great, right? Sex is great, right? Okay, so what happens when you put the two of them together? What you get is a honeypot CBD infused personal lubricant. Created by a couple who is wonderfully in love, Dennis and Jesse, Honeypot is the perfect lube to level up your sex life. They also have an intimate romantic massage oil to get you revved up and started called Romantic Escapades. You're definitely going to want to try these products. This wonderful couple put a ton of work into them. And if you want to learn more about them and their story, you can go ahead and visit that episode. Episode 59. Wouldn't it be great if it were 69? It really would have been. Oh, well. Anyway, give honeypot a try, give romantic escapades a try, and let me know what you think. You can go and learn more about them at fantasticescapades.com.
Hello, everyone. Welcome back. I am very excited for the conversation that I'm going to have today. First, I want to introduce my guest, Dr. Shyama Mathews. How are you doing today?
I'm doing well. How are you, Rachel?
I'm doing well, and I am very excited to dive into this. This is going to be the highlight of my day, which has been very stressful, and I just knew that I had this interview waiting, and I was like, all right, this will be the thing that redeems today.
Yeah.
No pressure, though. No pressure.
I feel you on the stressful day. And, no, I'm excited to talk to you tonight, too.
Great. Well, so you are an OBGYN, and so I kind of just want to dive into like all of the OBGYN questions, because as I was saying before we hit record, there's so many things that I wish I had known, 10 years ago when I started my sexual journey. And so I kind of just want to get it all out there. But before we do that, let's kind of start with you telling me and the listeners a little bit about you, how you came to be involved in this work, and just give us a little bit of an overview.
Sure. So I'm actually a gynecologist. I don't practice obstetrics. So obstetrics is the baby part. Yep. And gynecology is the everything except babies part about women's health. So I focus a lot on, general women's health care, wellness visits. I actually am a certified menopause practitioner. I'm also a minimally invasive GYN surgeon. I deal a lot with chronic pelvic pain, endometriosis, fibroids, sexual health, pain with intercourse, things like that. And then I have, in my journey and kind of, getting sort of more interested in these topics and educating on these topics, I found my way to becoming a medical advisor for a female sexual wellness company called Playground, which is a fantastic company developed by two incredibly smart women. And their focus is really bringing to market a product that is in tune with the female body. So it's a lubricant that's really meant to be fun and exciting, and then at the same time still part of taking care of you and not throwing your balance off. And so, being able to use something like lubricant without fear of getting an infection or causing irritation, and if anything, preventing them. So it's kind of cool. I was able to kind of get involved with them and in launching a product and kind of getting the word out. So I kind of use many different platforms really to bring education about all of these things to women of all ages.
Yeah, I loved going onto your website. You had an incredible page about different diagnoses and the different areas of expertise and education that you have. And it's a little education section. You don't just say, hey, I specialize in, and then provide a list. You say, these are the things that I can help you with. And then you go on to explain what they are, which I just think is incredible. Just in addition to being a resource, you're also a source of education, which is incredible.
Yeah, I think that's really important. I actually find that, a lot of times I'll meet women who come to my office and we'll talk about stuff, and they'll either have a lot of misconceptions or they'll be making decisions based on misinformation or lack of information that no one really explained their options to them. And that, when I take kind of 5 minutes, 10 minutes to really kind of explain, okay, well, this is why, this was suggested to you previously. And, what does that really mean? What are the implications of that? And that really helps people come to a better conclusion about their health, right? Like they can kind of take all that information and really sort of process it. And it makes a lot more sense. There's a lot less fear. There's a lot less mistrust around, decision-making about their body and about their health. So that's something that I find really important. So I kind of, focus on that.
Yeah, it was immediately the first thing I noticed. Kind of touching on like some of those misconceptions. You said, there are people who come in and are like, I didn't know what this was supposed to be. What are some of like the myths that you kind of hear most frequently that people come to you with?
Gosh, so many. You could pick an area, and there's like 5 or 6 in every aspect of women's health. The big one I focus on particularly, like I said, I deal with a lot of conditions that deal with pain. whether it's anatomic related to, their anatomy and whether they have cysts or fibroids or a condition like endometriosis, or whether it's because of infections or whatever, that sex that's painful is okay or normal, or that you can kind of grin and bear it and get through it and it'll get better if you push through it. That's a big one that people don't quite understand, that sex isn't meant to be painful. It shouldn't be painful.
Yeah.
So if it's painful, something's going on and you have to get that figured out. And same thing with recurrent infections and recurrent UTIs, things like that. Because I think it happens a lot to people. And so then they kind of normalize it, or they kind of brush it under the rug as something that, that doesn't need to be directly addressed. And so, those kinds of things I often find, again, take a little education and some sort of concerted effort to kind of straighten out. And there's actually often many different treatments available for both of those kinds of things.
Definitely. I wish somebody had told me early on, hey, you have to pee after sex, because I had no idea.
Yeah.
And then, that led to so many UTIs in my 20s. And then I discovered, and I don't know how medically proven this is, but knock on wood, it has done wonders for me. D-mannose has been an incredible.
Man. Yep.
Okay.
So
All right, good.
Yeah. So let's talk about that, right? Recurrent UTIs, what we call postcoital UTIs, or they even call it honeymoon cystitis. All those things are names for UTIs, or pain with urination that develops after having intercourse. And if you think about it, for whatever reason, when we were formed, our anatomy brings our urethra and our bladder, which is meant to be a sterile space, very close to very not sterile spaces.
Yeah.
So our vagina is not sterile, and obviously our rectum isn't either. And they're all right next to each other. Millimeters apart. And so you can imagine that having intercourse can sometimes transfer bacteria that lives in certain parts normally to places that they don't belong, like the urinary tract. And that's often what happens. But there are ways to reduce infections. I talked about one of the reasons I got involved with the lubricant company was because that's one of my big suggestions often is make sure you're well lubricated. And whether that means using a lubricant or, making sure that there's enough foreplay that you are, well lubricated before you have intercourse, all those things that are important, because if there's friction, if there's, irritation, if there's stretching of the tissue in ways that isn't really comfortable, that's going to contribute to, that transfer. And then the other thing, like you mentioned, D-mannose, I think D-mannose is brilliant. It is basically a supplement that you can get over the counter. And what it does is it coats the bladder wall, and it keeps that bacteria that's not supposed to be there, it keeps it from sticking. So it sort of allows it to then be flushed out. So you mentioned peeing after sex. When you go to pee after sex, then it helps it flush it out. So, that's why we do all of those things. And it's not unusual for many women, particularly in their 20s. So there's two kind of peaks in their 20s. And then also, again, kind of as they get into menopause, because of the hormone changes cause pH imbalances.
Oh, great.
Those are sort of the two. Yeah. Just so you know.
Glad I have that to look forward to.
But now you know how to address it, so you'll be fine. But those are the kind of two peak times where this becomes an issue. And if you keep on top of these things by, again, using a good lubricant that is sort of healthy and pH balancing, using something like a supplement like D-mannose, and then making sure you pee after sex, those kinds of things can definitely help reduce the recurrence of infections. And if you're doing all of those things and still getting infections, that's a possibility too. Some people just have very persistent kind of bacterial infections that kind of come from this. At those times, you can actually even talk to your doctor about using what's called a prophylactic dose of an antibiotic. So instead of taking a full dose of antibiotics that you typically take for a full-blown UTI or an infection, you actually take a sort of mini dose, and you can do it even preventatively. So if you know you're going to be intimate that night, or say just after, you can take just a small dose just to kind of, nip it in the bud, make sure that it doesn't progress the infection. We don't like to do that right off the bat.
Sure.
Because we don't want to, create antibiotic resistances or anything. But if, all the other things that we talked about are not really working, then sometimes people will have to use this for a short period of time. It's not usually like forever. It's usually just a kind of a phase as their body sort of adjusts.
Sure. Yeah. And I think that took me a really long time to realize too, like your body just needs time to adjust. Like even sometimes if you have a new sexual partner, your body just like needs time to get used to the new bacteria that's entering your body.
Yeah, it's like it's a new partner. It's like, say, with a new partner, you're more active than you had been previously. So, that balance is a little bit different. So yeah, a lot of different things. And then, like I mentioned, the pH kind of changes that happen with hormone changes. And naturally, our hormones kind of shift in general, right? Even in our, reproductive years, not even like at menopause or in puberty, but like in the middle, all those years in between, every few years, you'll notice that there'll be a little bit of differences in your hormone fluctuations. And that can sometimes contribute to it.
Definitely. And I know that like the best thing is that when you get a UTI and then you go and you get a prescription and the prescription gives you a yeast infection, that's my favorite. It's when that happens.
That happens a lot. I'm a bit proactive on that. I often will tell my patients, this may give you a yeast infection. So I'm going to call a medication for that too, just in case you feel that coming on. But yeah, that's not an uncommon thing either, so that's something important to remember too. So our vagina has its own microbiome. And what that means is that it has bacteria and yeast that are supposed to live there. So that's another misconception a lot of people have, that they think that they like acquired a bacterial infection, a vaginal infection, or they like acquired a yeast infection from somewhere else. And it's actually not the case. They're supposed to be there. There are certain types and strains of bacteria that are supposed to live in the vagina. And there's actually certain strains of bacteria, of yeast that are supposed to live in the vagina. And the problem is when you take, say, an antibiotic, and it can be for anything really, a UTI, it could be for, a strep throat, whatever, like any kind of infection, you end up knocking out that balance. So you knock out the healthy bacteria that live in the vagina. And then what happens? The yeast actually overgrows. So it's our own yeast. It's just overgrown and not in balance. And that's what causes the symptoms. So what you often need is something to bring it back into, the normal range, the balanced range. And so that's where, either treating it as a true blown yeast infection. I will often tell patients, tend towards yeast infections. Like say, for example, like if you're working out and you don't get to changing quickly or showering quickly afterwards, and you notice that kind of makes you feel a little bit off and, irritated down there. And that could be that the balance is being thrown off, that you have to be sort of mindful of that. And there are certain supplements that you can take. There are actually probiotics that are sort of built for the vaginal health. It's supposed to help replenish some of the healthy bacteria that's there, to kind of keep that balance, that pH balance in check. And that can be helpful if you're sort of trend towards that. Occasionally, I'll have patients use something like a boric acid suppository, which is over the counter as well. And that too is sort of pH balancing for the vagina specifically, because it helps bring the vaginal pH back to where it's supposed to be. Same thing. So, and if that pH is at that healthy level, then, that overgrowth can't really happen as easily. So things like that can be helpful too, to kind of get things back in the normal range. The other thing also to note, again, we mentioned menopause. When we get older and our hormones change, especially when we sort of drop our estrogen levels, estrogen is very helpful in maintaining the vaginal pH. So when it starts to decline because of menopause, or this is very relevant, sometimes certain birth control pills can do this too, because the way the birth control pills and the hormones actually suppress our own estrogen levels, in order to serve as a contraceptive, that can actually throw the vaginal pH off too. You may notice that things are drier, or you trend towards, yeast infections or bacterial infections more easily. And so those are things to pay attention to as well. And you can actually do things to help, again, correct that pH, whether it's hormonally or non-hormonally, to prevent that recurrence.
Okay. And talk to me about like how douching is not the right way to do that.
Oh my gosh. Yeah.
How do you clean a vagina? What's the proper way? And
cleaning organ. It's brilliant. It can take care of itself. It does not need any kind of fancy soaps. It does not need douching. It doesn't need anything like that, because we just talked about how it's supposed to have certain things at certain levels, right? So when you douche or when you use soap down there or any of those kinds of things, it actually works completely in the opposite direction, right? It wipes out all the healthy things. So we do not encourage that at all. Even in the area, mild soaps, nothing that has like crazy scents. You don't want anything too harsh. You don't need to do anything, excessive down there. Literally just let it rinse itself out. I think sometimes we tend to do too much. And part of it is, I think there's this, again, I think a global misconception that like, for whatever reason, it's dirty or like, it's not, it's not clean or what, we have this perception that it has to look or smell or be a certain way. And that's just not true either. So I think some of that has to be kind of dispelled as well.
Totally. I remember when I was like in 7th grade and boys who definitely hadn't seen a vagina would be talking about like fish smells. And I'm like, why aren't we talking about how gross balls can be? Like, really?
100%. 100%. And like way more often than, any
right.
that might arise for a woman.
Yeah, right. 100%. So I think that's definitely something to keep in mind also. It's that I think that we've been socialized from such a young age that, vaginas smell a certain way or that they look a certain way. And I know that there are young girls who are getting exposed to porn earlier and who are interested in getting labiaplasties because they think that their vagina should look more tucked in for whatever reason or shouldn't, look a certain way. And that makes me so sad because I always say the fact of the matter is if you're anywhere near my vagina, you are lucky to be there.
100%. Yes, I agree. And I think that's, that part of that is, education to that younger generation. And then also amongst ourselves, just how we talk about it and how open we are about it with one another. I mean, just respecting it for what it is, being kind to it. And then also, not letting anyone talk like down or shame the concept at all for us. I think that's like really important.
Absolutely. And on the subject of shame, I'm just kind of curious. This isn't a question that I had prepared and you can feel free not to answer it, but I'm wondering if you have any thoughts on like the hymen and the idea of virginity, this concept that, we've created.
So it's really interesting. That too, there's a lot of global and cultural nuances around that can be really difficult.
Totally.
With the hymen, so anatomically, the hymen is basically this sort of ridge of tissue that's at the very bottom of the opening of the vagina. And before we're sexually active and before we're sort of, even without like actually having necessarily like having had penetrative intercourse with like a partner, like that area doesn't necessarily get, stretched or stimulated much unless you're kind of, unless it's in a sexual manner. Right. So virginity to me, I think it's, yes, if you haven't had penetrative intercourse, technically that's what they consider from a virginity standpoint, right? But there are things that can be going on with the hymen that has to do with our development that isn't necessarily normal either. Meaning, like, just like we can have other kind of congenital differences in the way our body forms, that area can also be different because of a congenital development thing. So, like, you can have actually a hymen that's sort of overgrown or isn't in the proper position, or there's maybe some remnant kind of narrowing of the area, those kinds of things. And so that's something that often won't be detected until a much later time. Either it's when, if a girl who's gotten her period is trying to place a tampon and can't for some reason, or, they are trying to be intimate and they can't because there's like, too much pain, or sometimes they describe it as it feels like there's like a wall or something. That too needs to be assessed, because many times there's this thinking that there's something wrong with them, or that they try to push through that pain or try to like overcome it, and that can actually do a lot more harm than good. And so it often needs to be assessed from that perspective. And again, there's a lot of thoughts around like that it should be a certain tightness, that it should be a certain caliber, that that as we get older, or as our bodies change, and if we've had children, how it changes, and all of those kinds of things. I feel like, again, a lot of it surrounds how we think about it as a body part. Like, who is it for? You know what I mean? Like, there's a lot of feelings around that, I feel like. And again, culturally, there's one aspect of it where, especially if sexuality is sort of, and is like sort of shamed, or a negative concept in a culture, that too can play into it. And then also then how our bodies change. Again, do we accept it? Are we happy with it? Are we understanding like of the fact that this part of our body is a functional part of our body, and it's going through these changes for a reason, and we're cool with that? We celebrate that? Or is it something that we are, ashamed about, or feel, negatively about? Again, typically for others.
Definitely. No, absolutely. I couldn't have said it better myself. Well, and I didn't have all that information, but still, I couldn't have said it better even if I had. I'm kind of wondering if we can do like an overview of a menstrual cycle, because there are certain times that somebody could be more fertile. And there are lots of people out there I know who are trying the natural cycles method even more. And there's this idea that you can't get pregnant when you're on your period. There's this idea, and again, I don't even know if they're myths. These are things that I want to know the answer to, like that you can't get pregnant from pre-cum. These are the questions. And I'm kind of just wondering, in terms of fertility, what are some of those myths, and how does the menstrual cycle play into that?
So the menstrual cycle, just like anything that is that we know about our bodies, right? They're all based on sort of statistics and averages, right? So there's what we know is the average cycle, and that's what we base these things on. So we're basing this on the fact that the average menstrual cycle is like 28 days from the start of a period to the start of the next period. And then that means that around day 14 is when you would be ovulating. Once you've ovulated, you have a fertile window of typically, 48 hours or so, roughly, 48 to 72 hours, like where you're potentially fertile, where an ovulation, an egg is there for fertility purposes. And it's all based on averages, and it's a very sensitive system. Right? So it's one thing, some people are like clockwork. And if you're on like clockwork, you literally know on the calendar day, you could, throw a dart and hit on the day. Like, I know I'm ovulating that day. I know this is the day I'm getting my period. I know the time I'm getting my period, right? That's one thing. That is not the norm. I would say that there's a lot more variation typically. And it could be by a couple of days, or it could be by, several days. And that can totally throw a wrench in the whole natural cycle system. It's, and not only that, it's sensitive. So different things can throw it off. It could be things in the environment, whether it's our diet, travel, stress, how much sleep we're getting, what we've been eating. All of these things can play a role in how our cycle plays out. And so it becomes a bit more untrustworthy if you are relying on it from that method.
Sure.
So when someone tells me they're using natural cycles, as long as I typically do a follow-up question of like, and if it didn't work, would you be upset if you found out you were pregnant? And if they say no, then great. Natural cycles is fine. I mean, you're tracking your cycle, you're diligent about it, whatever. Great. That's not a problem. If you would be devastated, then you should be using something else.
Yes.
There should be something more going on. You cannot just rely on an imperfect system, because that's what we are. And as far as, pre-cum or I'll pull out, all those kinds of things. There is definitely still a possibility of semen and sperm being in pre-cum, in that level of semen. And if you think and you trust your partner to know when to pull out, then that's also pretty false, because most of them have no idea. And it isn't just when they climax and orgasm that like they are releasing sperm necessarily. So again, if you're okay with it, if the idea of becoming pregnant in that manner doesn't devastate you and you'd be fine with it, then fine. But if it would totally throw a wrench in your whole life at that moment for that to happen, then I would say, again, we should probably come up with some other, methods for protection there. And there are plenty of methods available that
absolutely
that are available, and thankfully, at least where we live. So we can talk about that, and it's not that everybody has to be on a birth control pill necessarily. It's more just like knowing what your options are, understanding what would be the best fit for you, having that conversation with a provider, and coming to a conclusion.
Absolutely. And I think it's very much trying different things. Like, you got to figure out what works for you. Sometimes, the extra dose of hormones that can be in some birth control pills aren't going to work for some people. I had, how you hear on the television and like those really happy, for some reason, birth control commercials that there's a risk of blood clots. And when I was a senior in high school, one of my best friends had her leg amputated.
Oh my God.
Because of blood clotting. Which is just like you see that on the TV and you're like, oh, okay, but it does happen. So it's important to talk to your doctor about all of those things and also like when you go, aren't there certain antibiotics that can completely nix your birth control?
It's that it can interfere with the clearance. So basically, these pills are really mini tiny doses of hormone, right? Like, they're small doses. Mm-hmm. So that's why it's so important. You have to take them every day at the same time, because if you take them kind of willy-nilly, like, those levels aren't going to remain consistent. And that's the same thing with other medications. Some other medications interfere with the way our body clears and processes the hormones. And so that can influence the efficacy. Right. So that's just like, and it's not just antibiotics. There are other medications that we take that, people might take for various reasons that can sometimes influence or interfere with that. And that might influence which type of, contraception you end up choosing, right? If you're educated on that. And then also at times if you, should be using a backup method, for example.
Definitely. That's why it's so important to talk to your doctor. I also love on your website that you talk about like how information is your friend, and listening to figure out what the best method is for a patient is really a big focus of yours.
Yeah. And I think, again, that's like another big misconception often related to contraceptions that, that some people don't even want to entertain the conversation because they think that, their doctor's just going to shove some pill at them and they're not going to, talk about other options. And that's it. They only have this like one size fits all plan. And that's not how it should be. There are so many options. There are, even just in the realm of birth controls, there are hundreds of them. So often when someone comes and says, yeah, I tried one, it was awful, it made me feel this way. Totally get it. That can happen. That actually happens very frequently. Mm-hmm. But what we need to know is that there's so many other ones that if you're in it together, like, we can figure out which way to go next, because there's a little bit of trial and error to it. Unfortunately, we haven't gotten to the point where we can do a blood test and say, oh, this is going to be the perfect fit for you, right?
Maybe someday.
Maybe someday. There are people working on that. But because we're not there yet, it is a little bit of trial and error. It's a little bit of figuring out, which way do we need to tweak it? And that only works if we're kind of in it together and kind of, trying it out. We're going to touch base again after a couple months, see pros and cons, which way did it go? What needs to be adjusted? Is it the dose? Is it the formulation? Is that not the right fit for you at all? Do you have you have trouble remembering to take a pill? Then maybe a pill is not your best choice anyway. So
right.
Talking about other things. So, having that as a conversation and figuring out what fits makes a lot more sense than, just throwing the same thing at everybody and hoping it sticks. And then, also losing that person's trust in other methods, and not educating them about what options they have open to them.
Definitely. No, absolutely. And
I'm wondering, on the note of birth control, do you have any comment on the, there are memes circling around about this on the internet? There was a male birth control that was put out there at one point and was tested. And I believe it's the case that men commented that the side effects were too intense. And the side effects were things like mood swings and acne and...
I can't even. There are so many things that I feel like if our only option was for a man to do it, that they would actually put some money and
right,
thought power and funding and resources into figuring it out. Right. Like if that was the way, and we know that this is true, so many different things, so many different health issues that if it involves men's health, often get figured out way faster. And so,
Viagra,
but like that, 100%. I mean, yes. We can talk about that in a minute if you want. Like, what options are there available for female low libido issues versus like what options are obviously available and covered by most insurances for men's low libido issues? Like, unbelievable. So yeah, birth control for sure is one of those things that I don't see any reason why, we really couldn't have figured that out for men's standpoint. And you're right. The concept that certain side effects were just intolerable for a man. But then if you look and listen to, yes, the happy person on the commercial listing out the hundreds of different potential side effects of all the different things that we put ourselves through, is pretty ridiculous.
Yeah. Like there's this meme that's like, do you know what I go through just so you can nut in me for like 5 extra seconds?
Exactly. It is, there's a disparity there that is 100% true. And I don't know what it'll take for our society and our politics and our, and our funding from, resources to figure that out and balance it correctly.
Yeah.
But yeah, a lot of that gets, sort of brushed under the rug.
And it's difficult because then a lot of and this is, going into really serious territory, but then all of the onus is on the woman. So the burden of getting pregnant, like, it's not the man who's going to have to carry the child. It's not, you know what I mean? Like it's all on the woman. And I know that, I started doing birth control because I was like, I don't know if I could trust a male partner to do what we have to take. Like and I'm the one who's on the line. It's my body that's on the line here and my life that would be completely changed.
Yeah. And 100% true. A responsible partner would be as invested in it as you are, right? Like, would be as invested in the choice of what are we doing to prevent a pregnancy, because it wouldn't be the right thing for either of us, right? And as a responsible caring partner, he wouldn't want that for himself, and he wouldn't want it for you. Like that conversation very rarely happens. And so often I counsel my patients too. Like, I mean, I have young patients that are, going off to college and things, and I tell them, go buy your own pack of condoms and keep them. Because do not 100%. Trust that your partner or whoever it is that you want to be intimate with is going to be the one to bring that to the table.
And if they tell you that they're too big for a condom.
Oh my gosh, please.
Or that it ruins your orgasm. It's like, okay, well, like, I'm probably like not going to at all. So we'll both suffer. But I mean, I remember I had my ex-boyfriend, I remember asking him, like, okay, if we're not going to have kids, like, would you mind getting a vasectomy? Then we wouldn't have to worry about it at all. I wouldn't have to, like, worry about my PMDD. I could figure out all of these different things. And he was like, I don't think so. And I was like, well, why not? And he said, well, I heard that the orgasm's just never the same. And I was like, I'm so sorry for you. Asshole.
Yeah, exactly. Yeah. No, I mean, there should be more readily available options. And that conversation never happens either, right? You were the one having that conversation with them. No one's having that conversation, unfortunately, I think, with men. and boys, and telling them, you know, this is just as much your responsibility in how you're going to approach this.
Totally.
And, you know, it shouldn't always just be on the woman in the picture.
100%. Well, and some of these different areas of expertise that you have that can lead to painful sex, do you kind of want to talk about those a little bit? Just give us a little bit of an overview of each of them and what they look like, what treatment options look like.
Sure.
Yeah.
So we talked about some of the hormonal things like frequent infections, hormone changes, birth control pills. I mean, anything like that can absolutely lead to vaginal dryness in sex, and then painful sex because of the dryness. And then that too, like, again, I got involved with the female sexual wellness company Playground because the whole concept that we're working on is that lubricant shouldn't be like a negative thing. Like, it shouldn't be something that you're using because somebody's, you know, you shouldn't be made to feel like you're broken or something's wrong with you. Just because you want it to be comfortable and, you know, not hurt and, you know, pleasurable in the moment, as opposed to having it dry and then become, you know, irritated, and then it's uncomfortable, you know what I mean? And then it cascades down a whole different path, which who wants that? No one wants that. But the idea that, like, using a lubricant, that there's something negative about it, and changing that perspective. And that's kind of one of the things that I found, you know, really sort of great about the way the company sort of approaches it. And that's what's really important about it. Like, it shouldn't be painful. And if anything is causing it to be painful, it actually creates this feedback loop. If sex is painful, then it affects a couple of different things. One, you don't want to have intercourse, so your interest wanes and your libido goes down, right? Because it's not comfortable, it's not painful. If it's not pleasurable, then your interest in it and your body's ability to reach arousal and climax is gone, right? So that there's a whole pattern of things that needs to happen, and it can't happen if your mind is telling you that this is not a positive experience, right? So there's that. Then there's a whole other side of it that's physical, that your musculoskeletal and vaginal walls, the pelvic floor, starts developing almost a fear of it. And in order to protect itself, it braces against pain. And that can create a condition called vaginismus, which is where the walls of the vagina sort of tighten and the muscles sort of brace. And that too is painful. So then you create, you know, something that's uncomfortable, you know, causing pain, then becomes more painful because the muscles are now reacting to it. And then it goes back and forth, right? So a lot of different conditions can cause this. Infections, like we talked about, trauma, a negative experience for whatever reason. And then medical conditions, like I deal with a lot of, and I treat a lot of patients that have chronic pelvic pain and endometriosis, for example. So, you know, they grow up having terrible, terrible nightmare periods, like terrible pain, cramps, all these things that happen to their body because of the hormones and that fluctuate, and how that affects the disease in their pelvis. And then that plays into their musculoskeletal system and how their pelvic floor reacts. And then that leads to, you know, all this, again, tightening, pulling on these muscles, pulling on the nerves surrounding it. And then the pain just sort of gets out of control. Like, it just escalates. So there's a lot of different things that can lead to that, unfortunately. And again, so many women will go through it and for a very long time without realizing that there's anything to do about it, or that it's not abnormal, and that it's not normal, and that they should be addressing it and talking to someone about it, et cetera. I work very closely with a lot of pelvic floor physical therapists, and they are incredible. I am a huge believer in pelvic floor physical therapy, and most women have never even heard of it. Have you heard of it before?
I have. I had a guest on who has endometriosis, and she was talking about the different dilators that she used in the physical therapy. So I have heard of it a little bit, but I also, you know, nerd out on this stuff constantly. So I do think I'm the minority rather than the majority.
Yeah, so I mean, most people are like looking at me like, "What are you talking about? Pelvic PT? Like, what does that mean? What does that even entail?" And it's actually their pelvic they're physical therapists that are specially trained in the pelvic floor. And our pelvic floor is the network of muscles that are in our pelvis. So like, that area like between our hips, it surrounds our bladder, it surrounds our vagina, it surrounds our rectum. It's all the muscles kind of in there. And the nerves, if you think about it, the nerves that come off of our spinal cord and traverse down into our legs pass through our pelvic floor. And it dictates all these things like how our bladder functions, how our bowel functions, and then also again with sex and the vagina, and even the intensity of the cramps that our uterus makes, like when, we're at certain points in our cycle. All of that is manipulated and dependent on this network of muscles. And the therapists that concentrate on this really focus on those muscle groups and are able to help you learn how to target some of those muscles, whether it's through breathing exercises, stretches. You mentioned dilators. There's even like a wand is what we call one type that has a specific shape to it, so you can target some of those internal muscles.
Okay.
And these pelvic physical therapists will actually work with you internally, meaning like through the vagina, pushing on those muscles, sometimes even rectally. And then also externally, like on your abdominal wall, in your groin, and like through your thighs, those areas as well, to help you learn to target some of those muscles and how to relax them. Because we don't really think about that part of our bodies.
No,
right? Like, we don't think about it the way that we would, stretch our back or arch our back if we have back pain, or our shoulders hurt, how we would roll our shoulders and, do things to sort of loosen other tight muscles that may be in spasm. We don't know how to target those. So you have to learn, you have to be taught. And that's what physical therapists do. And I'm lucky to know some incredible ones in our area, which are they're fantastic. Because this is all they do. They treat people that have pain, and they really help them navigate this and really get them, to sort of a better place. And it may take, a couple of weeks, it may take several months. Sometimes it takes several years. It varies depending on the degree of issues and damage. But they're pretty incredible resources. So, it's something that I often will have to convince someone to go and do it and give it a try. And if anything, I tell them, you're going to learn a lot about your body. But I would say the majority end up coming back telling me that it changed their life.
I bet. Yeah. I'm actually doing a lot of somatic therapy right now, just because I have realized, like, due to the aforementioned trauma, like, that I am so disconnected from my body. And anything that is going to bring more attention to being present and feeling what's actually happening is going to be beneficial.
Yeah. Yeah, absolutely.
Like, really,
they help
truly
you target that. Like, how they help you really kind of pay attention to those things. And it's amazing the things that we do that are kind of innate in us as protective measures, right? We're trying to protect ourselves against that kind of pain, but it actually kind of backfires in some ways. And then, that can lead to this whole cascade of issues that you sometimes don't even realize how all this stuff is connected, and they really help kind of bring those things to light. It's pretty amazing.
Definitely. Well, and moving forward, lay it on me. What do I have to look forward to with perimenopause and menopause?
So
I hear that orgasms get better.
They can. Yeah, actually. Orgasms can get better. Libido can be either way. I've had some women come in and tell me my libido is like on fire. It's amazing. And others that say that, things are a little bit different and a little bit off. But it really is one of those things that you're right. A lot of people don't know. They don't know what to expect. And it can be really kind of alarming and sometimes a little scary for some women to go through it, because no one's ever told them what to expect. And the average age of menopause is 51, but like in your mid 40s, you can start experiencing hormone fluctuations that can cause things to change and be different. And, it can be kind of surprising when you don't realize what all is going on. So the hormone changes that happen, like, so, you think menopause and you think everything just like shuts off, and it doesn't. It actually kind of goes through this whole up and down roller coaster for a little while. That's what we call perimenopause. So that can start anywhere in our 40s. And it may be during a time where our periods are still actually regular. It doesn't even have, they don't even have to be irregular yet. But you may start, things like temperature dysregulation, so like hot flushes, night sweats, libido fluctuating, sleep disturbances, um, mood. You mentioned PMDD before, but perimenopause is another time too, where because of the hormone fluctuations, mood can be an issue, whether it's depression or anxiety.
Woohoo.
Can fluctuate. Yeah. But what I often tell people is that, like, even just being aware that these things can happen
Totally.
really does help you
Yeah.
manage it, right? Because at least you know what's happening, you know what's going on, and you're like, okay, I know what this is, and then you know that there are ways to seek help for that, like and
Just knowing, even like, I've been having periods for over 15 years now, and I'll have like an emotional meltdown and be like, I don't know why I'm so emotional. And then my period will come and I'll be like, oh, right. Okay.
Right.
But like, having that awareness and being aware that these things can happen and that they're to be expected and there's nothing, you're not crazy. That can really be a huge reliever, I think.
Yes. And that is actually a very common conversation. You're not crazy. This is not just in your head. There is something going on. And guess what? There are things we can do for it. And just having that conversation is often, even if we don't end up starting medication or anything, I feel like people leave my office being like, oh my gosh, okay, like I can tackle this. I can handle this because, I know what I'm dealing with now.
Definitely. And so menopause, it's kind of, you said it's not the body just kind of shutting down. There's this process that's a little bit of ups and downs. And once that's happened, it's no more periods, right?
Yeah. That's probably the biggest perk.
Yeah.
There's no period. So basically, by definition, we call menopause 1 full year of not getting your period.
Okay.
And so once you've gone through that, like, again, because of this particular hormone balance, once you get to that point, then, we consider that menopause. And then you're right, no more periods after that point. It may still be a bit of an adjustment, like, the other kind of symptoms might take some time to sort of settle out. And it's different from person to person as far as how long those kinds of things get to settle. But when our body reaches sort of a steady state in the hormones, like it gets sort of used to its new norm, then that's where, the most of those other symptoms go away or lessen.
Interesting. Okay. Well, have that on the horizon to look forward to, I guess. We're kind of going to start wrapping up here, but a couple more questions that I really am curious on your answer for. What do you wish that penis owners understood about vaginas?
That it is a very sort of precious and smart and, beautiful thing that should be respected and taken care of. And like you said, you're lucky to be here. I think there should be more appreciation for it. I feel like there's, again, such negativity and negative connotations surrounding periods and the vagina and, cleanliness and all these things. And it's sort of, I think the concept of how special and how much it does and how much it achieves, like, is sort of lost on the other half.
Yeah, and it's been like that. I mean, since that, even you read the book like The Red Tent about back in like BC, like they would have women who were on their period and who were considered unclean, sequestered from the rest of them. So it's from a long way. It goes back. It's not anything new, unfortunately. Yeah. Well, what do you think some of the most important things that somebody should do to improve and maintain their vaginal health? I mean, I know we talked about a lot of things in this overview, but specifically, like, if there's anything else we haven't touched on.
Again, I think trying to maintain as much of that balance in whatever way. Again, good hydration and good diet. Obviously, those things are really important for our whole bodies, but our vaginas are particularly sensitive as well, and that's helpful. Not overdoing it from the over cleaning standpoint.
Mm-hmm.
Again, with making sure there's proper lubrication and using products that are well designed and well thought out and created with the vaginal health in mind is really important too. Taking care of it. So like if there's an issue, don't ignore it. Don't, let it slide and put up with it. Like, just like you wouldn't do that if something was going on your face. Like don't ignore your vagina either. So, seeking out help for it if there's a problem that seems to be happening again and again or worsening in any way.
Definitely. And I, would tack onto that having a GYN who really is willing to listen, like you said, is so vital, because our bodies in general are an intimate part of ourselves, but this is like the most intimate part of ourselves. And it's good to know that you have somebody on your team who's listening to you and actually cares about you as an individual, not just as a patient.
Yeah. Yes. And I think that is also, you shouldn't ever feel ashamed or embarrassed to talk about these issues with your doctor, with your provider, like whether it's your gynecologist or your primary care doctor or whatever. I mean, if it's not their area of expertise, it's one thing, but like then seek out somebody whose area it is, and they definitely should be able to be openly discussing it with you and listening to you. And if they're not, then you probably want to find somebody who will.
Definitely. Yeah. Well, any last thoughts? In addition to that, where can people find you, keep up with what you're doing, etc.?
Sure. So the website that you were alluding to earlier is drmatthewsgyn.com. And then that's my Instagram handle as well. And then I'm also on Playground, helloplayground.com. There is, we're actually launching it this week, I believe. There's office hours with Dr. Shyama, it's a kind of there'll be blog posts, there'll be a forum to ask questions. There'll be, interesting articles and things like that kind of pop up there as well. So that's another place that, again, a platform that I use for education as well.
Amazing. All right. Well, Dr. Shyama, thank you so much for all of this information, for doing kind of this quick hour of education. I think it's so important to just have all of these answers in kind of one place. So I hope that listeners take a lot away, and definitely want to keep up and see what else I can keep learning from you on all the things on the internet. So I'll be following you for sure.
That's wonderful to hear. Thank you so much, Rachel. It's been a pleasure talking with you. And I really appreciate that you bring this kind of information to your listeners.
Yeah, it's why I do it, right? I'm like, like I said, I wish I had this information 10 years ago. So hopefully someone will now. All right, everyone. And thank you for tuning in today. You've been listening to Wine, Dine, and 69. I'm your host, Rachel Dalton, and let's keep talking.